Bill C-237 is a private member's bill that was introduced by Member of Parliament Sonia Sidhu for Brampton South, and it is an act to establish a national diabetes framework. It's really important in Canada because it makes it the law that Canada has to have a national diabetes framework, which we haven't had for the last number of years, and that's partly why diabetes is such a burden on Canada and Canadians. The World Health Organization recommends that every country have a national diabetes strategy or framework. And now that Bill C-237 has been passed by both the House of Commons and the Senate unanimously, it's the law in Canada that we have to have one too. Diabetes 360 is a strategy for a national diabetes framework that was developed by Diabetes Canada and by hundreds of diabetes stakeholders across the community. It lays out 4 targets for the improvement of diabetes in Canada around prevention, screening, treatment, and patient health outcomes. It was developed based on the really effective strategy in the case of HIV/AIDS. And when it is implemented, it will really improve the lives of many people with diabetes by making it easier for us to see what kinds of care and treatment work best, by making access to care more equitable and quicker and easier for people all across Canada, by making it more consistent what kinds of medications or devices or supplies are covered from one province or territory to the next, and by helping us to really zero in on what kinds of things we can do to make patient health better for those that are affected by diabetes. It will benefit you regardless of what kind of diabetes you have and regardless of where you live, coast to coast. Bill C-237, now that it's the law, creates a pathway for us to implement the recommendations of Diabetes Canada's Diabetes 360 strategy. If you live in a province that is small or large or a territory, you will benefit from a national framework for diabetes just as much. Your province or territory will be able to compare itself more readily to other provinces and territories in terms of the incidence of diabetes and in terms of what kinds of programs are really working to help their citizens that have diabetes or are at risk of it. It will help us to better compare what kinds of treatments work, and it will help us be clearer on how we can be more equitable from one province or territory to the next in terms of the medications, devices, and supplies that are covered. A lot of people wonder what Bill C-237 or Diabetes 360 will mean for their life. If you live with diabetes, whether it's type 1 or type 2 or one of the more rare forms, it can make a big difference to your life. It may make it easier for you to access quality healthcare in your community. It may make it easier for relatives of yours or loved ones who may be at risk of developing type 2 diabetes to get screened for the condition. It may make it easier for you to get access to life-changing or life-saving medications and treatments by ensuring that our coverage of those devices and treatments and medications is more equitable. It may make it easier for you to get into a prescribed care pathway if you're starting to develop one of the many complications of diabetes. So it really makes it easier for us to see where the problems are with diabetes and what works in reducing those problems. And I think that 10 years from now, Canadians with diabetes are going to be in a much better spot than they are now because Bill C-237 passed on June 21st, 2021. Just in time for the 100th anniversary of the discovery of insulin.